Arizona will be open for learning. That's what's in front of us in the coming school year. I've been visiting a lot with public K-12 education leaders, our school leaders and our superintendents, hearing from principals and others in terms of where we are, along with our fine public universities, visiting with Michael Crow, Dr. Michael Crow, Dr. Bobby Robbins, and Dr. Rita Chang to get their input on best practices and what's possible in this next school year. I want you to know that Arizona will be open for learning this school year. We've put a date out there about 5 weeks away. We've gotten the most recent input from school leaders and public school superintendents. I'm going to be sitting down and working with Superintendent of Public Instruction, Kathy Hoffman, along with other constituencies to get the best guidance on what we're going to do going forward. I know people want clarity around this, and we're going to provide clarity. I'm going to tell you, our kids are going to be learning in the fall. We're going to do our best to conduct the most positive educational year that we can, and I'll be providing the most specific guidance that I can. I'm going to be working with Superintendent Hoffman on that, and expect that next week, and that will provide additional or include additional flexibilities to our schools around the state. I want to give an update on not only public health, but what's happening with Arizona families in the state of Arizona, especially families that have been displaced through this. Let's start with pandemic unemployment assistance and relief. Over $6.4 billion in unemployment benefit claims have been paid to date, helping over 958,000 Arizonans. It's almost impossible to get your head around that number. Before the pandemic struck, I think we had less than 17,000 people in our state on unemployment. Today it's over 958,000. I want people to be aware that are receiving these benefits, that we are experiencing fraud attempts. They've been witnessed in other states. We've been working with the FBI and Department of Labor to continue combating this fraud and to ensure the dollars are preserved for the Arizonans that need them. And I realize it may have caused some inconvenience or slight interruption in some of your payments. We think we have our hands around that now, and there will be more to follow. I also want to talk about the housing protections for Arizonans protected by COVID-19. It's been some time since we talked about the March 24th executive order to delay evictions for those impacted by COVID-19. This established the COVID-19 rental assistance program administered by the Arizona Community Action Agencies. To date, we've put $1.2 million plus provided to Arizona renters, and the order is scheduled to expire July 25th. So I've got an update on this, along with a new executive order extending the eviction moratorium on residential evictions until October 31st, along with $650,000 for community action agencies to improve staffing and administration of rental assistance programs and providing assistance to families and individuals faster. In addition, $5 million to establish the foreclosure prevention program. And this will provide targeted relief to homeowners who rely on income from tenants to help them avoid foreclosure. In total, state and local governments have directed more than $80 million on programs to assist renters and prevent homelessness. Additional actions. Earlier this week, $1.6 million from the U.S. Department of Housing and Urban Development Emergency Solutions Grant was distributed to combat homelessness. This is going to support counseling service, guidance on independent living, rental assistance, as well as homeless shelters throughout the state. In addition, we've provided $250,000 from Chicanos por la Causa, and I want to thank David Adami for the organization's statewide housing program, which finds housing for homeless individuals. And in May, $300,000 provided to St. Vincent de Paul and Open Hearts, providing Arizonans in need with rental assistance, telehealth, and transportation to health services.